Okay, thank you to come first.
Shall I look here or there?
As you like, don't worry. We are making this CME course for frail patient, and we are discussing about which kind of information we have to exchange, and we wonder which is the best way of sending a common way to have the same information. Can you tell us why ICPC can be most worth to use for primary care?
Well, to understand the differences between ICPC and ICD codes, you need to basically go back to the origins of why they were created. The ICPC system was created with primary care as its primary focus, while the ICD codes were originally created to classify causes of death, and which it was then used to classify diseases. But as we all know, not all patients present diseases. Some of them may present symptoms or signs, and the ICPC system offers the granularity or a better quantification of the typical situations that a primary care physician would be confronted with. The ICD codes may offer more granularity and more specificity, but the primary care doctor is not always as concerned with whether it's the left arm or the right arm. They're more concerned with the overall presentation. One also has to look at what the purposes of utilizing the codes will be, whether it would be for a payment system or whether it would be for just simply recording on a medical record the patient's situation. And therefore the ICPC code, given its origins in primary care, it was developed for primary care and addresses the issues that a primary care provider faces, is the more appropriate coding system for the primary care setting.
So practically for the benefit of the people, ICPC is responding more what primary care can do to them.
Correct. Correct. It's more intuitive for a primary care clinician to understand and utilize.
And just to squeeze a very difficult question, do you foresee that ICD and ICPC can work together in the future? I know that there is some investment to make them working together.
Yes.
For the future. Do you have any idea if this is a kind of work that is done, and when it's supposed to be possible to exchange one information from one side to the other side?
Both systems are evolving. ICD-11 is currently being developed. At the same time, ICPC-3 coding system is being developed, and there are currently being efforts made to look at working the two together into a joint coding system so that countries can utilize both simultaneously.
Okay, thank you very much.
You're welcome.